Hey, Onco PTs, and welcome back to this episode of the Onco PT podcast. Now, as we wrap up 2023, which again, still can't believe that we're at this point in time in the year, but here we are. As we wrap up 2023, one of the things I like to do at the end of the year is look back on some of the amazing podcast episodes we had, some of the most incredible, influential guests, and kind of do a wrap up of some themes. And so that theme part is something I'm doing a little differently this year. And so far, I'm really liking it. And I want to hear about your thoughts too, as far as what do you think about having the themed episodes and then those recaps. Let me know on Instagram. You can message me. My handle, my username is the Onco PT, and I would love to hear what you're thinking about this new kind of December vibe for the podcast. So in today's episode, what we're doing is we're really talking about something that I have come to, appreciate a little more over the last year, especially past few years of my practice. Now, when I first started as a physical therapist, I was so done with school. Genuinely. I'm extremely privileged. I started preschool and then was able to go all the way, like straight through, no breaks, preschool, right into elementary school, middle school, high school, college, and then PT school. So I think by the time that all was said and done, I had been going to school for like 20 plus years at that point straight through. And I was so done. Like, over it. I couldn't wait to be done and working and bring home a paycheck and not ever look at a textbook again. And then about a year later, I started studying for my specialization exam. Now, the path with which I took to get to that point of deciding, okay, I need to specialize was more of it was kind of what people were doing. It's what one of my clinical instructors and mentors encouraged me to do. And I kind of thought, I feel like this is the good step for me, right? And it truly wasn't until after I had started preparing to be a specialist and then had become a specialist and was practicing that I really understood why it was so important for me to specialize and why I'm now seeing more and more of the importance of we need to have more specialists within oncology physical therapy. Now, this first clip that I'm going to show you is part of the reason why I've really arrived at this conclusion. And I know that everybody has a little different take on specialization. What I'd like for you to do is I want you to listen to this first clip that I have queued up, which is part of the reason why I think that specialization is so important for us as physical therapists to really consider. Now, I know it's not for everybody. I totally get that. But what I do believe, even if you choose to not take the exam, right, to not take the oncology specialty certification exam, preparing to specialize, diving deep into the knowledge and the literature and the information available out there to become the best possible, most knowledgeable onco PT that you can be is the best way, period, that I know how and that I have come to appreciate over my 5 years of practice and doing the Onco PT podcast. This is what I have come to realize is the best way that we can truly show up for our patients confidently and competently. So anyways, let's go ahead and listen to that first clip. You, as the oncology physical therapist, possess a profound ability to positively influence the lives of your patients dealing with cancer. Cancer sucks all day, every day. And the unique challenges that these patients can face extend beyond just the medical treatments, right? They encompass the physical and emotional toll that this disease and its treatments can take. And by pursuing oncology specialization, you gain the expertise to truly address these challenges head on, which is so important. As we know, our patients experience a lot of complications, and we need a provider who can actually step up to the plate with an air of confidence, with a true experience of confidence and say, I know how to address this. I know how to help with this particular issue that you're facing. Because I'm seeing, like I said, I'm seeing a lot of not that these days. And so by really charging forward to meet these challenges head on, you are helping to provide a crucial layer of care that these patients often lack. And in doing so, you're helping your patients not just survive after a cancer diagnosis, but to live and truly thrive. And that's what we're after in cancer rehab. So if you'll remember, a few weeks ago on the podcast, I shared a story about a patient that I had who had metastatic breast cancer. We knew she had a timeline, right? We knew there was an end date. We didn't know what it was. We knew that we were kind of progressing towards some kind of an end date at some point. So there was no getting around it. Like, we knew what we were working with. But in the time that we were working together, we had some very specific goals. Specifically, this patient wanted to feel better despite living with metastatic breast cancer and still undergoing treatments. And the way we identified together is that she was going to feel better is by getting out and moving some more. This was something she was interested in. She was ready to try. We had problem solved through a bunch of different issues. So some of these issues that we were facing at the time, it was summer in Texas, which, if you can believe, it was not as hot as what it is today. I feel like this summer has just been such a different level of hot, but I digress. With this patient, it was summertime and it was hot, and this patient felt most comfortable and safest walking around inside of her apartment complex. But we knew we had the summer heat to contend with. So what we did is we worked it into her schedule to where she would get up in the mornings and walk before it got hot. And after a few weeks of doing this, of her walking, and it literally took months to get this patient confident to the point she wanted to pursue this. So it was a long journey. After just a few weeks of her walking around in her apartment complex, she felt better. She really did. Now, did I take away all of her pain? No, of course not. But she felt better because she was getting up and walking around. It was helping to manage some of her pain a little better. She felt like she was actually doing something helpful for her body. And she felt a sense of accomplishment after all this. So, feeling really good, I actually went away for a few days to go and visit my sister. And by the time that I came back, I had to spend the remaining 4 weeks of my employment at this institution picking up the pieces. Because while I was out, I had a sub-therapist who came and treated this particular patient. And in the span of 2 visits, my patient had decided that she was no longer walking, she didn't want to come to PT anymore, and she basically gave up all semblance of hope because of what this therapist had told her. In short, this therapist told her that the reason she had metastatic breast cancer is because she was fat, and the whole reason that she was dealing with lymphedema, which was one of her impairments we were addressing, is because she was fat, and then she was never going to do anything that could possibly help any of the situation. Now, if you've listened to that previous episode where I talk about this, you know how upset this makes me. And I'm trying to keep it really concise today because I don't need to go off the rails again. But this is just another example of an all too common experience that patients face in cancer rehab. And I pray it's not you. I hope to God, to the universe, that this is not you. But the amount of times that I have encountered this in my own practice where I am picking up the pieces of my patients who have been just completely run over by other therapists who should know better, it's mind-blowing how commonly this occurs. And I tell this story because it is such a powerful reminder that through our expertise and compassion, you can contribute to a true healing experience for your patients, even if we know that the healing of the cancer is not going to happen, right? When it comes to metastatic breast cancer, that is not, cure is not the end goal. I want it to be. I wish it is for our patients, but realistically, I know that that is not what we're working towards. What we're working towards in that case is independence and functionality and quality of life. And we were doing all of these things with that patient before this other therapist, this sub-therapist, came into the picture. You can, as a compassionate expert, contribute positively to this holistic living experience for your patients, especially those who are facing the challenges of cancer treatment and survivorship, whatever that looks like for them. And I firmly believe, because of what I've seen with other clinicians, both in my area and out of my area, that specializing in oncology physical therapy sets you on a path to gain some really important knowledge and perspective and critical decision making that only benefits your patients. And while you may be thinking, Elise, I don't know if that story really supports specialization, I do believe that, and here's why. If you have the knowledge behind how to show up as the best possible onco-PT for your patients, because you're more confident in knowing how to best address the impairments your patients are experiencing, you're not worrying as much. You're not stressing out as much. And I'm not saying that's the only reason why this PT was such a genuinely trashy person towards my patients. I do believe that had this PT been a little more confident in dosing appropriately and actually working with oncology patients, that they would have shown up with a little more emotional intelligence and, frankly, capacity for the patient. Would that have fixed everything? No. But I do believe that when you have a deeper understanding of how to treat these patients, you show up better as a clinician. And that is what your patients deserve, and I will die on that hill. You can probably tell in that clip how fired up I get about that patient case in particular. And again, I will link to the original episodes in the show notes for today's recap episode. But I don't know that I have ever been so angry and frustrated in a patient care situation than at that moment of when I came back from what was supposed to be a nice rest break with my sister to having to basically play clean up and catch up for the last 4 weeks that I was employed by this institution, and all to try and salvage one person's, it was actually multiple patients, but in this particular case, we're talking about my one patient with metastatic breast cancer, all to try and salvage some relationship that she could have with moving her body and exercising and trying to feel better. And I think that was probably one of the hardest things that I've ever had to do as a physical therapist to date. I'm sure there will be more challenging things ahead, but that was really, really hard. And I felt really bad. And there was a lot of guilt behind leaving because I also felt like I was leaving my patient in a situation. Anyways, there was a lot that went into that. But I hope you can appreciate from that first clip of just how badly we need practitioners who feel confident in what they're doing and who show up fully for our patients. Because we see what happens, as I just laid out, when we don't have these kinds of clinicians, when we have clinicians who maybe don't actually know fully what they're doing and aren't confident in how they're treating their patients, to where we make bad decisions. Now, let me be clear, because this next clip that we're going into is talking about making mistakes. And I truly believe there's a very, very firm difference between making mistakes as you learn and as you grow and making poor decisions. And that poor decision is definitely the theme of this first clip. But I want you to go into this next clip with this concept of as we learn, as we grow, as we develop as onco PTs, it is okay to have mistakes, to make mistakes, but where the difference is that we learn and grow from that mistake. And I feel like this, you'll hear the quote that I reference in this next clip, and it just makes me chuckle so much because it's something that I have really found in my own career to make a lot of impact. So anyways, without further ado, I'm going to tune you into this next clip where we talk about what is really the best fertilizer for your onco PT career and how this relates into specialization. Take a listen. In cancer rehab, there is an overwhelming amount of fear and uncertainty when working with oncology patients. And this could be due to a variety of different things, right? We know that cancer is a scary diagnosis. There's no denying that. Cancer is scary. Sometimes it's definitely scary for our patients, but sometimes it's also scary for us, especially when we're newer to working with this patient population. Maybe the fear of God instilled in our hearts by our professors in PT school around the contraindication of modalities and cancer being a contraindication for everything we do is contributing to that fear. I know that's definitely the case for me, at least it was. But maybe it's also the apprehension of treating patients who are so medically complex and dynamic and all the things, right? I'm thinking about the first time I ever worked with a patient who had bone metastases, right? All of these concerns and considerations are valid to a degree. But what I see more often than anything else in cancer rehab is underdosing and not challenging our patients enough appropriately. Remember, thinking back to, there is a difference between treating patients so as not to hurt them and treating patients to help them. Those are very different. And what I want you to take away from this is we need to be treating patients to help them, not out of a place of fear. Because again, not only does that not help our patients, this is what is holding our profession back. The entire field of cancer rehab, this is what is holding us back. I heard a quote last week, actually for the second time. I've heard this quote previously, and I kind of laughed it off, but it wasn't until I heard this quote for the second time last week that I really kind of sat back and thought, I need to think about this a little bit. So I've really gotten into the House of Herbie podcast by Queen Herbie. She's a rapper, if you haven't heard of her before. And the quote she said was, "Shit is the best fertilizer." And again, get your giggles out now because I totally giggled the first time I heard it. But when you start to think about it, this is so true. And it's so applicable for cancer rehab. I think that's what shocked me probably the most when I really thought about it. I was like, oh, I feel called out right now in a good way, right? So when you sit with this and when you kind of think about the context and the meaning behind this, this is a really appropriate approach or way to move forward in cancer rehab with this mentality of I want to help my patients rather than I want to not hurt my patients. So in gardening, we're bringing the gardening back around, y'all. In gardening and farming, I'm revealing my Midwestern roots right now. Manure, aka shit, is frequently used as fertilizer to help plants grow because there are nutrients in it, right? But shit is also the best fertilizer in onco-PT, in cancer rehab. And what I mean by shit, I don't mean trash. I don't mean like purposely picking things that are harmful to patients. That is not what we're going for here. When I say shit, when I think of fertilizer, I think of this, I equate this in cancer rehab as trying different things, trying new things, trying different approaches, interventions, perspectives, etc., even if they don't seem like the conventional way of addressing XYZ impairment. Now, typically, when we implement an intervention or an approach, etc., there's going to be one of two outcomes. Number one, it's going to work. Or number two, it's not going to work. Now, if it doesn't work, then we say, all right, that didn't work. We're going to try something new next time. But if it does work, we're helping our patients with something that we probably would not have even thought of previously. We wouldn't have tried it. And so when we approach things from this is an opportunity to try something different, to try something unique, to try something that maybe I normally wouldn't do, but I want to try it in this situation. I think how we treat lymphedema is a pretty good example of this. So if we think about if lymphedema were a brand new condition today, right? If the first person to ever develop lymphedema developed it in the year 2023, our reaction to that, unfortunately sometimes still today, but I digress, our reaction to a person experiencing swelling is, let's get you on some diuretics because we know that helps for swelling, or at least some swelling. Or in maybe a different situation, let's drain it, right? Let's drain that fluid out of there. Now, you and I know That is actually two of the worst things that we could really do if we are going to appropriately manage lymphedema for a person. But based on our current awareness and what we know about swelling, is like those are sometimes some really appropriate interventions for other people with swelling. So by that line of thought, like it should work for lymphedema. Again, you and I know differently. So imagine then when lymphedema treatment was really starting to take off in Europe over the last century, this person or these persons came up with this kind of crazy, a little harebrained approach of managing lymphedema, at least by my standards, right? So instead of let's give them medicine, let's drain the fluid, they said, you know what, we're going to put these patients in a series of bandages. They're not going to be like ACE bandages. They're going to be something called short stretch bandages. We're going to do different exercises to help the fluid move. And then we're also going to do this manual technique that it's not a massage because it's not getting down and, deep into the muscles. It's a little lighter than that. People probably thought that those individuals were out of their mind, right? At face value, that kind of sounds like a bad idea. Again, thinking about because of what we know about other swellings and their response to diuretics, draining the fluid, etc., but then pivot, and lymphedema does not respond to those things. In fact, those things can even make lymphedema worse. And again, nowadays, complete decongestive therapy is very much accepted as this is what we do for patients with lymphedema. Now, does it need updates? Yeah, totally. Like we needed some work in here. But at the time, I imagine it was quite groundbreaking. And I also imagine that at the time, there were a lot of people who were like, you're crazy. Like you need go get out of town because you're not going to do that to my patients and your crazy ideas. Like that's just not going to work. And sure enough, it is. And it's still being used today. So these seemingly, quote, harebrained ideas, these implementation of new approaches are how we actually advance cancer rehab. We're not done advancing cancer rehab. We still have a lot to learn. And unfortunately, I think that we have really kind of stagnated over the past few years as far as how do we really improve cancer rehab. Has there been progress made? Yes. But I think that we have kind of slowed down and we need to get back on track. And I think a lot of it stems from we are practicing as an industry mainly out of I don't want to hurt my patients rather than I want to help my patients. And I'm going to continue to challenge you. You need to be practicing over here. I want to help my patients. This needs to outweigh the fear of hurting them. And so again, how we do this is by changing our perspective, our approach to making mistakes. Mistakes are not a bad thing all the time. In fact, they are growth opportunities. They are opportunities for innovation, right? And so I want you to get out there and I want you to try new things. I want you to curate opportunities for innovation in your practice by thinking outside of the box. What shit can you try that could potentially really help your patient? And if you're thinking right now, Elise, this all sounds fine and dandy, but like, I know I'm afraid still of making mistakes. Girl, same. We're going to work on it together. Here are 5 steps that we are going to work on together to make this happen, that I want you to implement in your practice if we're really going to transform cancer rehab. So step 1 is cultivate curiosity. Curiosity is the absolute key to turning mistakes into opportunities for growth. Again, no longer look at them as mistakes, but opportunities to grow. Curious people tend to ask more questions. And it's not just the asking of the question that is so important here. It's as we ask the questions, we are then thinking and seeking the answers. We're seeking out new information to inform our approach, again, to maybe give us those answers, but also what can we try to address, again, XYZ impairment here. And curious people are more open to new experiences. Again, maybe implementing a little different approach to some traditional interventions to help address or treat an impairment. When you're curious, you're more likely to seek out feedback and reflect on your actions, which can help you identify areas for growth and development. So, step one is cultivate curiosity in you, in yourself. Step two is then we got to act on it, and then we're going to reflect on our growth opportunity. So get out there, do the thing, right? Lay down some shit fertilizer, and reflect on your growth opportunity. Taking the time, and this does require you to take time here, taking the time to reflect on your mistakes or your growth opportunities, right? That's what we're branding them from now on. And what you can learn from them is crucial to both personal and professional growth. Reflecting on these growth opportunities allows you to examine your actions, your thought processes, your decision making skills that ultimately got to you to where you are today, right? As you're having these reflections with yourself, maybe even with others on, you know what, I tried this thing and it didn't work with my patient. What can you take away from that process, right? It's not just a, I made the mistake. I'm going to move on, right? No, we have to sit with it for a little bit. We have to let it stew a little bit so that we can kind of draw out what is this information that we need to be reflecting on right now. And reflecting on our growth opportunity allows you to identify areas for improvement and also develop strategies to prevent similar mistakes from happening in the future. And again, we are not trying to avoid mistakes altogether. We're trying to say, okay, this didn't work this time. What should I be taking away from this so that I don't make a same mistake or a similar mistake in the future? What can I try differently that maybe will work next time? Now, we've been hearing a lot from me in this episode, so I wanted to pull in another interview that I did with Dr. Jen Bernstein back in, August or September. And what I had her on the podcast to talk about was actually the MOSCI process. And you may be thinking, Elise, I'm just starting on the specialization process. Like the MOSCI is at least 3 years away from me. Friend, I was there. I really was. And then all of a sudden I woke up one day and now I'm in the middle of my own MOSCI process, like cycle one. And I don't know where the time went, but it's here. And I say this to let you know it goes by so fast. So even if you are not even close to the MOSCI process, I've pulled out some really impactful clips from my interview with Jen that I think you're really going to love that are both applicable to, of course, the MOSCI process, if that's where you're at, but also kind of the mindset and the framing of maybe you need a little bit of a kickstart or a gentle kick in the butt, right? To get started on your own specialization process. Because if you are working on the 2024 exam, we're getting down to the wire, right? Which is kind of exciting. It's also a little scary. So here is some incredible motivation and encouragement from Dr. Jen Bernstein from an interview we did previously. Take a listen.
And what this maintenance process has taught me is that just naturally, by by being a voice, by writing those abstracts, by putting yourself out there to students, all of these things that coincidentally help you maintain your certification, you are changing the right. I mean, come on. Crazy. You are helping the patients we treat because what we're seeing is our patients live longer, which is beautiful. But because of that, we are seeing these lifelong impairments. And so we may have short term success, but what does that long term success look like for these patients? We're not sure. But that is the beauty of this process. I think naturally, and again, I use myself as examples a lot because what else can I speak to better than myself? But I will tell you, when that letter came about maintenance, I was furious. I was so angry. And I know I talked about it. I was like, isn't it enough? I did all this stuff. I proved to you. I proved to you I'm good enough. And now you want me to keep going. But now, the way I look at it is you are giving me a platform. And it's not a to-do list. It's not a checklist. It's a way to empower other professionals to help our patients because we're not the only ones who treat them. Even though I would love to treat every oncology patient in the world, right? But the truth is we don't. And so by getting ourselves out there and following these prompts that are provided to us, we are changing the outcome for our patients in the long run. I mean, what more could we want?
Jen is so wonderful, and I'm so glad that I had her on the podcast. Now, we're not done with Jen because I actually have a couple more clips from her episode that are really going to talk about kind of the how. Now that we've talked about the why, the how of specialization here. Take a listen.
And I finally got to the point where I reached out to several other specialists, you included, and I was like, what in the world do I write about? What do I do? How do I make this different than the 60 other case reports they're reading with this group? So that they remember why I was chosen to sit for this exam and why they're proud to label me as a specialist. And the great Scott Capozza wrote back. Hello, Scott, if you're listening. Great Scott Capozza wrote back and he said, write about something that you would be proud to tell me and teach me about. And I was like, okay. And I sat down and I finished my case report in an hour and a half.
Oh my God.
Yes. Because I no longer was sitting there thinking about what are people going to think when they read this.
Mm-hmm.
I sat down and I wrote about something that I was proud of. And that changed it for me completely.
Mm-hmm.
And then I got approved. I passed this process. So I know what I did was worth it.
Now, we've talked a little bit more about the how, but some of you may be even wondering more. What is the process? Like, how much time should I actually dedicate to this entire MOSCI situation? And again, maybe you're not in the MOSCI yet, but this is great information to store in your brain or maybe even bookmark on your device and come back to when it's time for your MOSCI. So in this last clip that I have for you here, Jen is diving into the kind of how much time should you really set aside? What kind of a timeline should you be working on as you're working through your own MOSCI process? On that note, for the listener who is thinking about starting this process or is starting this process, how long do you think listeners should budget to complete this process?
Yeah, God, that's a loaded question, Elise. That feels like a loaded question to me.
Specialty. It's my specialty.
Right? And I'm like, oh, let me take a deep breath. I am a planner.
Mm-hmm. Mm-hmm.
I think realistically, enjoy your year, enjoy your first year, see what's out there, dabble in different things, reach out to new people. I think realistically budgeting yourself the second 2 years to really finalize what calls to you, what you enjoy, is the smartest way to go. I think what's also a little bit different now is people are coming into this specialization not necessarily as a new clinician. A lot of people have a ton of experience at this point, and they're like, now there's this thing offered, it's established, and you guys might not have to work as hard because you're already out there and doing things. So I think also take into consideration where you are in your career. Don't let it scare you. Don't let it hold you back. But somebody who has been teaching or who has been frequently publishing articles, who has been involved at higher levels within the APTA, you just naturally may be able to accomplish those things a little bit quicker. Whereas somebody who is just starting out, who has this love for this beautiful population that we work with, it might take you a little bit longer to find out what calls to you. And I think that's the other important part about this maintenance process is, yes, when you break it down to technicalities, there are things you're checking off, right? But make them things
Right.
that you love.
Right.
And so
Right.
take time to find what you love so that it doesn't feel as overwhelming. But give yourself the time that you need, whether that time is right away so you can plan, or whether that time is I need to explore. But I mean, I would be crazy to tell you that you could accomplish this starting 3 months before your maintenance
Yeah.
is due. I mean, there's just no
Yeah.
way. Give yourself the time, but understand what that time looks like to you.
Thank you so much for listening to this episode of the OncoPT podcast. I'm so excited that you tuned in to share this with me. Next week, we are continuing with our wrap-up episodes of 2023, which is so exciting. And then I'm just giving you a little preview. In 2 weeks, that last episode in December, we are doing a very, very special birthday celebration because if you didn't know, the OncoPT podcast turned 5 this month, which is so crazy. I'm kind of flabbergasted that we got to this point, but hey, we made it. And here's to the next 5 years. So until then, I just wanted to leave you with a little excitement and a little preview of what's going on. Make sure you're subscribed to the OncoPT podcast in your favorite podcast player, and I'll see you next week. Until then, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.